Assalamualaikum warahmatullahi wabarakatuh. I'm Fairuz Salsabila Faisal, and today I'm going to deliver a presentation about neoplasm. First of all, neoplasm is a type of abnormal and excessive growth called neoplasia of the tissue. So this growth is uncoordinated with the surrounding tissues, and it persists on growing abnormally even if the original trigger is removed. So this abnormal growth usually form a mass, and this mass is called tumor. Next, there are two types of tumor, benign and malignant. So benign tumor is a tumor that looks like the surrounding tissues and has a slow growth rate and also don't invade the surrounding tissue and they do not metastasize. While malignant is um, are commonly called as cancer. They invade and they destroy the surrounding tissue and they form metastasis and spread to different parts of the body. And next, the difference. So there are four differences. First of all, differentiation. So in benign tumor, they resemble the tissue of origin and well differentiated, while malignant tumors are poorly or completely undifferentiated, or as we usually call it, anaplastic. And next is the rate of growth. So benign tumor tends to be more slow in growth, while the malignant tumor are faster. And local invasiveness, benign tumor are well circumscribed and have a capsule, while malignant tumors don't. And malignant tumors tend to invade the surrounding tissues. In distant spread, benign tumor remain localized in the site of origin, while malignant tumor are locally invasive and also can spread to the other part of the body because of its metastasizing nature. And next is grading and staging. So staging and grading scheme have been devised for malignant neoplasm because the stage or grade may determine the treatment and the prognosis. So in general, the higher the stage, the larger a neoplasm is and the farther it has likely spread. So grading are based upon the microscopic appearance of malignant neoplasm. In general, a higher grade means there are lesser degree of differentiation. As you can see here, a well-differentiated neoplasm is composed of cells that closely resemble the cell of origin, while poorly differentiated neoplasm have cells that are difficult to recognize as to their cell of origin. And next, their staging. So the most common system for staging employs the TNM classification. T-score is based upon the size or the extent of invasion, and score indicates the extent of lymph node involvement, and M-score indicate whether distant metastases are present. Next are diagnostic methods. There are history and physical examination. So it can be achieved by talking to the patient and through direct examination. For example, you can see the sign or symptoms such as weight loss, fatigue, or pain. And sometimes the mass may be palpable or visible. Next, radiographic techniques. This technique can be achieved by using X-ray, CT scan, MRI, mammography, or ultrasonography. And this technique um, may aid in staging and determination of the therapy that is going to be used. Next is laboratory analysis. So in laboratory analysis, um, we can use CEA, AFP, or HCG, but unfortunately, they are not that specific or sensitive, but there are more specific testing, such as the measurement of PSA levels. And next, there are genetic testing. And next is tissue biopsy. And next is treatment for neoplasia. Surgery, radiation, chemotherapy, biotherapy, immunotherapy, and physical agent. Okay, that's all from me. Thank you for listening. Assalamualaikum warahmatullahi wabarakatuh.